I have so much hope for all that we're seeing around the world, all the people that are stepping up. But something made me more excited than I could possibly imagine, and that is seeing scientists stand up and talking to the right people. I saw this tweet this week from Health and Human Services, Secretary of Health and Human Services, Alex Azar. Look at this. Today, I met with Dr. Atlas and 3 distinguished infectious disease experts to discuss COVID-19 science and data from around the world as part of our commitment to ensure we hear broad and diverse scientific perspectives. Of course, he was meeting with Dr. Martin Kulldorff from Harvard, Dr. Sunetra Gupta from Oxford, and Dr. Jay Bhattacharya from Stanford. These are powerhouses in science from around the world. We have been mentioning their names from the beginning. In fact, I told you many months ago there was at least over 100 world-renowned scientists that were speaking out against this lockdown, these draconian measures, saying these are unwarranted. In fact, they're going to do more damage than good. Well, these 3 brilliant scientists were in town talking to Alex Azar, and they were a part of an interview. I think you should take a look at what is now happening. The scientists are defecting this COVID crisis. They're joining the side that is right, the side of light, and they're speaking out. Take a look at this.
An alternative strategy for dealing with the current crisis, and that strategy essentially consists of shielding the vulnerable, those in care homes, obviously, and stopping infections in hospitals, but also more generally in the community. We think we can do that while allowing those who are not vulnerable to this disease to go out there and get infected and build up what we call, and will continue to call, herd immunity, which is a level of immunity in the population that reduces the risk for everybody. Many of us, quite independently, have come up with or have been thinking in various different ways, but this has not been given a wide reception. I, in fact, met with resistance.
Dr. Gupta just mentioned herd immunity. You know, she came right out with it. That's the phrase that people are very anxious to avoid using. I mean, even the Swedes say that that's not their strategy, that just is a possible byproduct. Are you advocating a herd immunity strategy?
So herd immunity is not a strategy. Herd immunity is a fact about most infectious diseases, the course that they spread through the population. Even if we were to have an effective vaccine, we would be relying on herd immunity as the endpoint of this infectious disease epidemic. So it's less of a strategy than a recognition of a biological fact.
If we do nothing, then we're going to have some old and some young people getting infected, and we'll have a lot of death. If we protect everybody equally, then we can have some, eventually, it will take longer time, we're sort of stretching it out, but eventually we can have some old people and some young people getting infected, so we'll have many deaths. So the overall strategy is to protect the elderly while letting the young live their lives.
Can I ask you, how does this interplay with politics? We are literally in the middle of a presidential election, and the president is in hospital with the disease.
I think in the context of an epidemic that has touched every human on the face of the earth, it's inevitable that it'll be political. I don't actually know the politics of my colleagues. I'm pretty sure that if we did, we'd probably disagree. What's striking to me is that despite this diverse background, we've come to an agreement about what the science is telling us. This is a science-based approach, and it's aimed at minimizing the harm to the population at large. And I think that's the message we want to send.
Yes, yes, and yes. Finally, discussions about herd immunity, folks. Whether it's a vaccine or it happens naturally, herd immunity is the goal. And any idiot out there saying, I can't believe you used the term herd immunity. It's not a strategy, folks. It's a scientific fact. And it's so awesome to hear these three scientists really getting public about this, traveling, some of them all the way to America to discuss this with our White House. But even bigger than that, remember, just a few months ago, I said 120 doctors are speaking out, virologists, scientists around the world. Well, it is multiplied to now over 15,000 and growing every single day. Why is it growing? Because those three scientists you just saw speaking have written a letter. It's called the Great Barrington Declaration. And this declaration has a lot. You should check it out. We're going to show you how in a minute, but look what it goes on to say. As infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental health impacts of the prevailing COVID-19 policies and recommend an approach we call focused protection. The most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection while better protecting those who are at higher risk. We call this focused protection. Those who are not vulnerable should immediately be allowed to resume life as normal. Simple hygiene measures such as hand washing and staying home when sick should be practiced by everyone to reduce the herd immunity threshold. Schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Arts, music, sport, and other cultural activities should resume. People who are more at risk may participate if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. Adopting measures to protect the vulnerable should be the central aim of public health responses to COVID-19. This is not a conspiracy of a tiny group of people that are all working for the WHO or Bill Gates. This is the growing body of world-renowned scientists across the world are now rising up. Look at this number as of this morning. Medical and public health scientists, 4,944 of them have now signed this petition. Medical practitioners, 9,419, counting every single minute. So guess what? In the general public, 130,000 so far have signed on to the Great Barrington Declaration. Guess what? It's time for our call to action.
We are the citizens of the United States of America.
Raise your hand if you have a child or family member that was injured by a vaccine.
I want you all to say it with me. My child, my choice.
Mr. Speaker, I beg, I implore, a thorough investigation is warranted.
It is wrong to say that there are no risks to vaccines.
We're the army of truth.
Never doubt that a small group of thoughtful, committed citizens can change the world.
Get out there and fight for your rights.
Stand up. Be brave.
It's time to stand up and be brave, and you can do it from your own home. Please, right now, at the end of this show, just go online. All you have to do is go to www.gbdeclaration.org. Go to sign the declaration. If your doctor's awesome, scientists, awesome, but even regular people, put in all of your information there and stand with those that are telling the truth, that believe in real science around the world. We must do this together. These numbers should be exploding right now all over this incredible declaration. Let's stand with those scientists that are now saying enough is enough. It is time for facts, not fiction. It is time for science, not agenda. The world is changing. We are rising, and we are now being joined by those that actually matter. The scientists that understand the truth, and they're now speaking to world leaders. Let us support them in this declaration. If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, iTunes, and Twitter. We'll see you there.